Lovely, thank you very much, and welcome to those of you that have joined us today for our CoolSculpting webinar. This was the second actually of our webinars, and the first one we did on Wednesday was very well received. So we really hope you enjoy it, and we hope you get a lot from it. So I'll tell you how the webinar is going to go. It will last about an hour, and we kept pretty much to time on Wednesday, and it's basically a way of letting us inform you about CoolSculpting, telling you all about it, what it might be able to do for you, to discuss the areas that are actually the top win areas to actually treat with CoolSculpting. And then towards the end of the presentation, we're going to be showing you some real patient photographs, real patient stories. And I think that's where you have the most insight into what this procedure actually does. And as I said, what it might potentially be able to offer you. I'm very lucky because I have some excellent CoolSculpting practitioners, and today online I have with me Ria, who is a very experienced CoolSculpting specialist who's been working at our Buckinghamshire clinic and in our London clinic, and she'll be able to go through the photographs with me and talk about how we got the results we did. So Ria, are you there? Can you give us a little hello?
Hello, good afternoon everyone.
Thank you, Ria, for joining us this afternoon. And then at the end, what we're going to do after we've shown you the befores and afters, we're just going to open up a quick Q&A session. So anything you want to ask, just put it into the chat box, and we'll do our very, very best to answer those questions for you. We'll also have a slide at the end that tells you how to book a complimentary consultation if you wish to do so. And there is an exclusive offer for attendees, which we will show you at the end of this presentation. So hopefully it will be a good, interactive, relaxed webinar, and I hope it will give some insight into very exciting technology. So next slide, please. So just to give you a little overview about us, my name is Tracy Mountford. I've been in the aesthetics industry for a very long time, about 30 years. And we have a number of non-surgical aesthetic clinics across the UK, in London, Buckinghamshire, and nationwide. And that is where we can provide CoolSculpting services. We have a big team. We have doctors, nurses, CoolSculpting specialists. And we actually first engaged with CoolSculpting quite a long time ago, about 8-9 years ago now, where we actually were looking for a non-surgical solution to permanent fat reduction. Currently we performed a huge number of treatments. So we feel we're in a position now to be able to tell you about exactly what the treatment involves and exactly the realistic expectation you can have for this treatment. So we hope at the end of this it will be very, very clear. So can you move on to the next slide, please, for me? So what is CoolSculpting? I will confess it almost sounds too good to be true. And I first got this many years ago, as I said, when I first looked at it. What most patients are after nowadays is a surgical result with body contouring, but with a non-surgical solution. And this seems to offer that kind of result, because what we have here is a treatment which doesn't require surgery. It doesn't have scarring. There's no needles. There's very little downtime. We'll talk about that at the end, because for some people there is zero downtime. For other people, they may get just a few days of feeling a little uncomfortable. But actually, you know, at the end of the day, the results are what makes this an exciting treatment. The results are long-term as well. So you'll see from this presentation that we're not just shrinking fat cells. What we're actually doing is destroying them permanently, which is, that's why it gives results equivalent to a surgical procedure. And in some cases, in my opinion, better in some cases. And the results are pretty quick. And I think we all live very busy lives, pacey lives, and actually people are quite impatient. And the results come through at about 8 to 12 weeks. And again, we'll show you real patients with real photographs of our own to show you what the results look like at about 8 weeks. Next slide, please. Lovely. So this just encapsulates what CoolSculpting does. And the key elements to get across it are this, that the procedure's been on the market for quite a long time now. As I said, I've had it in my clinic for nearly 10 years. So it's been on the market a long time. Over that time, there's been a huge research and development improvement. So what we found, what we were doing, and Ria can touch on this later, what we were doing 10 years ago, which is actually still pretty good, it has become so much more sophisticated now. And what we do in clinics nowadays, we can get very clever treatment programs to get really bespoke results for you. So what this treatment is doing, it's designed to shift stubborn areas of fat that are resistant to diet and exercise. So those areas where you've got a pocket of fat and you can actually sort of pinch it, squeeze it, and no matter how you live your life, you still can't seem to shift those areas that are stubborn. So this procedure is designed for those of you who feel that way, and it gives a very natural endpoint. We're not here, and I said this on Wednesday when we did our presentation on Wednesday as well, we're not talking here about, you know, just saying you've got to be this shape or that shape or a thin shape, not at all. It's basically a way of getting the body contoured in any shape you want to, so that we can just enjoy the shape we are and enjoy the results we give. So we'll show you this later on. We're giving really realistic before and after photography, which is very, very natural indeed. So what this slide is showing you, and we'll show an animated version of this in a moment, is if you look at the top left-hand slide, that's just, if you like, a side view of a tummy, of an abdomen. And when we are at adolescence, we have a defined number of fat cells that don't really change. They stay as they are. We are what we are. And when we lose weight and when we gain weight, all that happens is those fat cells either swell or they shrink when we lose weight. They remain there. They're like an envelope or a balloon that we inflate when we gain weight and deflate when we lose weight. And that's why when we gain and lose weight, we tend to do that in the same areas. We tend to do it always in the same areas. What the slide on the right-hand side shows at the top is that once we identify an area to treat with a cooling procedure, like CoolSculpting, we are targeting a certain number of fat cells. We're actually freezing them to a certain temperature. And what happens then is the body crystallizes. The fat cells actually crystallize. They undergo this crystallization process. And your body then recognizes those fat cells as being foreign material. So our body knows when something recognizes our own material in our body. As soon as those fat cells are altered, the body recognizes that as foreign body, and it will destroy those fat cells naturally. So what happens is our immune system kicks in, targets the fat cells that have been crystallized, destroys them, excretes them through the lymphatics and bowel. And so you get a gradual reduction in the fat cell layer. And that is why it takes about 8 weeks to see the full effect. This varies from person to person. Some people see a result quicker, some people see a result a little slower, but nonetheless, it's about 8 weeks that we do our first review. And why this technology is so clever is basically recognizing that fat cells are more susceptible to temperature change than other cells in the body, or certainly they're susceptible quicker than other cells in the body. So that is why this technology has no negative impact on other tissues like skin, muscle, or bone. And the technology is terribly clever to identify that. That's what makes it a very exciting procedure. So if we just show the animation, you'll be able to see this in an animated version. So you'll see here, let's say this is a side view of the tummy. We apply the cooling. The cooling targets a certain percentage of fat cells, which we'll go through later. The cells crystallize, are damaged, shrink, are destroyed by the body, then completely destroyed, and are eliminated from the body by the lymphatics and bowels. So you see this very, very, very clear result. So what areas can it treat? And I apologize to gentlemen who might be watching this, because this technology is equally good for men and women. And what we find, and Ria will say this later, is that we treat an equal number of men and women. It's pretty much a 50-50 split. So that's really very interesting. But why I like this slide is it clearly identifies the areas that we routinely treat and the areas that patients routinely come to us and ask about and say, look, what can you do for this? And what can you do for that? So, I'm not going to go through this, but you can see the submental area there, which is under the chin, this area that can be very full in men and women, and it's often genetic. It's often, a lot of people say, I've actually had this since I was very young. Submental fat can actually be treated really, really well with CoolSculpting. We assess you a specific way, but it is very dramatic, the results there. And again, we'll show you photography later. Back fat, bra fat, the fat that hangs over the top of the bra straps, even when you're wearing a really nice dress or a really nice sort of t-shirt, even when people don't have any kind of issues with their weight, they're absolutely comfortable with the weight they're at. Often you see these undulating areas where there's little pockets of fat that we can target very, very nicely. Upper arm, again, is a very popular one because, again, a lot of ladies will comment if they wear sleeveless tops, t-shirts. It's an area they're quite self-conscious about, and we get great results there. And the upper abdomen and lower abdomen, big win areas, as are the flanks. So the abdomen, the whole three-dimensional approach to treating you, which we'll show, doing the abdomen, maybe doing the love handle area so that when you put up jeans or trousers, there's no overhang. Very, very nice, smooth results. Inner and outer thigh as well. For men, we can do male breast tissue. So the male breast tissue, if that's big, and if there's other considerations there, which I'll talk about shortly, but also the main popular area for men. Abdomen, flanks, big popular areas for men. Very, very nice results indeed. Next slide, please. So yeah, this is just a very very basic slide, but I included it for a reason, because a lot of people say that, can you treat this? Can you treat that? Are there some areas you can treat and others you can't? Well, the answer to that in a nutshell is yes, there are some areas we can treat very well. There are some areas we would say no, which again, I'll elaborate on later. But the general rule of thumb is, if you can squeeze the fat and you can pull it away from the body, you can pull it away from your abdomen or from your arm, then we can generally treat it very effectively. We take other considerations into account, but nonetheless, generally speaking, yes. So if you can grab it and squeeze it, we can generally treat it. Next slide, please. So we're just going to show you what you might expect when you come into clinic for your CoolSculpting journey, and then I'll elaborate on that afterwards. So if you could play this video, please. think that gave a very general overview of what you can expect when you come into clinic. But what we find is that nowadays, as I say many times, I probably repeat myself on this, what I see over and over the years, what's happening with these treatments, which are very exciting, is that patients more and more are looking for surgical results with a non-surgical solution. And the evolution of these treatments has made this industry very exciting, actually, because this treatment is FDA cleared, which means it's proven to work. It's really effective for certain areas, as I've said. So what we're looking at here when we're doing your assessment is we stand you in front of a mirror. This wasn't shown in this video, but normally what Rhea will do, and she'll say later, is when she assesses you in clinic, she will stand you in front of a mirror and look at you three-dimensionally. She'll swirl you round, she'll look at you, she'll discuss with you, what do you want to get from this treatment? Because at the end of the day, we want to create a bespoke, personalized treatment plan that's unique to you. Not one patient is the same. And I cannot stress this enough. Not one person is the same. People's desires and goals vary hugely. And this is not about thinness. This is about trying to achieve what you want for your body. So we really do feel very committed to trying to match what we deliver for you to what you're trying to achieve. So as I say, this is important for us when we assess you, trying to get into your head, so we understand what you really want to achieve. More than one area can be treated in one treatment session, which we'll show you on the befores and afters in a moment. But it's important to say that with this technology, there's no preparation. Once we've assessed you, once we've discussed your goals, once we want to know the investment that you're prepared to put into your body, our job is to get this all, the personalized plan set out for you and start this program going for you. And what might illustrate this the best way, rather than me just talking, is to show you some real patient images and results here. So let's start, because I think this is what we find gives the most to you all when you're looking at this webinar. We can talk and talk, but at the end of the day, the proof of this treatment is in what it delivers. So Rhea, I'm going to start now. Everyone's heard enough of me waffling on. So let's talk to you, because you're the girl that does this treatment. You're the person that delivers these results. And I think this is what we get the most engagement with prospective patients with, is these befores and afters. So can you just talk me through what the story was here with this patient?
So this lady came 6 months after her twins' pregnancy, and she just didn't feel right in her jeans. She couldn't fit it into her jeans, and she just wanted to feel more herself. And as you can see from the photo, she's had a fantastic result and she's very happy.
It's a really nice result. Can we see a side view, please? Yeah, really nice. So it was 6 months and post twins, wasn't it? Again, very easy treatment to deliver good results, really. Is this the most common area that you normally treat a lot of abdos and flanks, don't you?
Definitely. It does concern a lot of male and female patients, if not their whole lives, at some point post-pregnancy, surgeries, menopause.
Yeah, it's lovely. And so if we could just move on to, this is 8 weeks later. So this is really, really quick. And I think that's what is the soonest you find? So can we just be very transparent and talk about what people can expect immediately after? I'll talk about during the treatment in a moment, but sort of when they have, no, actually let's talk about, because we haven't touched on this, what does the treatment feel like? I mean, I've had it done, so I know what it feels like, and you get feedback every day. What does the treatment actually feel like to a patient?
So initially you will feel the suction, which just feels like it's hugging the area. You just feel the applicator secure to the targeted area. You then do feel very cold, just slightly tingly, a little uncomfortable, perhaps for 5 to 10 minutes, and then you go numb, so you don't feel much for the remainder. And the applicators are on generally for 35 or 45 minutes. It's only the out-of-fly treatment that's on for slightly longer, for 1 hour and 15. We take that off, we do a 2-minute massage, which is a little unpleasant. Unfortunately, it's the most important part post-treatment, just to break the fat cells down a little bit more to help your body get rid of them. But that's the part that most people say is slightly uncomfortable, is the 2-minute massage. And then afterwards, you will get some swelling because your body will remove those fat cells. So you will just puff up slightly in these areas, feel a little tender to touch for 3 to 7 days, and then that will really start to go down. And you could even start to see your results as early as 2 to 3 weeks. It will become more obvious to you nearer the 6 to 8 week mark.
Yeah, so really, that was a great analysis, because, you know, I cannot stress enough, this is a medical treatment. It works. And it is not a beauty treatment, it's a medical treatment. So I'm afraid there's going to be some pinch, there's going to be something, even though there's no need for compression garments, there's no need for the pre-prep or the, you know, like there is with surgery. That, I suppose, is what's appealing to a patient, isn't it? That there's none of this sort of prepping beforehand, lots of aftercare. That is the big win. But nonetheless, this is medical. And therefore, you're going to get something, because if it works, which it does, you're going to get some little bit of tingling, swelling, sting. So I think that's a fair representation out of the treatment. Can we just see the next slide, please? Because this is a great one. And I know that you've got this treatment's very close to your heart, isn't it, Ria? Can you talk us through this one, please?
So this is a lady post-menopause. Just felt that she didn't feel herself anymore. She felt very apple-shaped. Her skin texture had changed. She wasn't completely unhappy, but she knew she just could be more happy with the area, and training and exercise didn't really do much for her. So we've had a great retraction on the skin, and we've just altered her shape. She would say she actually looks better than ever.
That's really impressive. That's amazing. I mean, I love this. I mean, at the end of the day, we always talk about what makes us go to work every day. I know you talk about this. It's happy patients. And I think this is a really good example for people to look at, because one of the questions we do get asked a lot, and I know you get asked in clinic a lot, is, hold on a minute, we're getting rid of the fat and the skin quality isn't as firm as, say, it was when we were in our, 20s. What happens to the skin? I'm just going to end up with an empty balloon of skin. And I think what this demonstrates very well is the physical cooling, and the fact that the fat cells reduce very gradually seem to cause the skin to actually tighten back and actually look better than before, which is something we see quite a bit in the chin treatment as well, which we'll show later. And the arm treatment. The arm treatment is another one where you see really nice skin retraction and elasticity coming back in. Can we see the side view on this patient, please? Because I think, is there a side one? Oh, there isn't, but you've got side ones in clinic we can show, haven't you? Yeah. So, again, this is important, because for all age categories, you can actually get really nice, smooth results. And the fact that someone says this is the best figure I've had for a long time is incredibly good. Can we see the next slide, please? And men, I think these are great treatments. I was saying on Wednesday when I looked at this, and I've seen these in clinic before, for men this is such a big win. I'll get you to talk through it, but this man has a great physique anyway before you've even treated him. So tell me the story, tell us the story.
So he works very hard in the gym, and he just felt that he had this extra layer that he just wanted to get down, and it takes, real strict diet, and it still wasn't as narrow as he'd like, and it's not maintainable to train your hardest and be your strictest with your diet forever. So he had one set of treatment, just lower abdomen and flank area, and then we did plan to possibly revisit, and we did a bit more, because this gent wanted the best results that he could get. So we did a second lot of treatment. We did less treatment, but we still went over the lower abdomen and the flank area again, and this is his treatment outcome. He couldn't be happier. It
was great. Can we see it? Because this one I know we've got a side view of. It's incredible.
Yeah, it's changed his confidence in all aspects of his life.
Yeah, he actually looks, I'll be honest, I'm going to play the devil's advocate. It looks like he's lost weight, but we do and he hasn't, has he?
No, he did. He's much more motivated, so he may be sort of training even harder, but he's generally around the same weight.
Yeah, and so just to be clear about this, what we do in clinic, don't know what you do, is you weigh people before treatments and after more, because we want to make sure that we can say these are reproducible results that have been acquired as a consequence of CoolSculpting. But this touches on another point that is relevant. I was asked questions about this on Wednesday, which is that, and you touched on it, what you find, don't you, and I get this from our other CoolSculpting practitioners, is that sometimes this kickstarts people into just looking after themselves a bit more, or actually putting more investment into their bodies. Would you say that's true? Does it kickstart people into better lifestyle choices?
Definitely. It's very demotivating when you're working really hard and you're always looking at that little body area that bothers you, and it just doesn't seem to change significantly compared to the rest of the body. So it definitely.
Yeah, it does that. And a common question people ask is, you know, what size or shape do I have to be to consider CoolSculpting? And we do have to be very careful what we say about that. And again, I know Rhea will have strong views, but actually, you know, the ideal patient for CoolSculpting will be what actually is an ideal liposuction patient, meaning someone who's got stubborn areas of fat that are resistant to diet and exercise, which I said earlier. However, there are people that we take, you know, we treat everybody individually. And there are some people who we treated who perhaps fall very slightly out of that. We wouldn't treat somebody who really needs to go on a very, you know, diet, who has health issues associated with their weight, because we would be wrong to do that. We would help get them to facilitate other areas to make them lose weight, help them adopt better lifestyles. However, we have actually treated people that were perhaps on the slightly heavier side, who they wanted to actually embark on something, couldn't get their mojo to start. And CoolSculpting, in combination with dietary changes and lifestyle changes, have really helped them on their way.
Definitely. I mean, if somebody's on their weight loss journey and we can keep their chin and make them feel happier, and that's an area that presents itself all the time, and it's an area you can't hide if you're not happy, you can still impact everybody, you know, the patient's life, as long as it's appropriate to what they want to achieve.
Yeah, that's great. We'll show that later. Next slide, please. Yeah, it's the back. Yes, it's just doing one thing. I won't go on and on, but you know, women are S shapes and men are V shapes. So what we're trying to do when we do our treatment is enhance the natural curve of a person. As I said, this is not about thinness. I keep saying that. This is about just trying to create exactly what you want, but men are more of that V. And I think this back view demonstrates that very, very well. Next slide, please. Yeah, it's lovely. So that's the proof of the pudding, as I always say, is in what people say, the feedback they give, and that's why we do this treatment. Next slide, please. This is an interesting one. We know what's been treated here, and sometimes for people, so it's almost a spot the area treated, isn't it, this one? But it's a very popular area for ladies. So brief story on this one, please, Rhea.
So this lady actually lost a lot of weight. She lost around 10 stone, and then she found a whole new wardrobe. She was wearing the dresses she always wanted to wear, the tops, and found that this little pocket of fat that she called her extra boob was just really standing out to her and ruining her outfits that she's really proud to be in now.
What a lovely story. So for those who are just looking at this, this is where the arm, forgive me if I'm stating the obvious, but it's where the arm meets the breast on that, the foreground there, that extra pocket. And that's actually an area that lots and lots of women have issues with, no matter what shape and size they are. You know, when you're wearing these strappy things, there's nothing worse than that overhang. And I think that's the universal problem for a lot of women, no matter what size or shape we are. And again, this is reinforcing, this treatment makes people look and feel better in their clothes. This is about just enjoying the shape you are, enjoying what you're wearing. And that's what I feel is the empowering thing for people. Next slide, please. Isn't this, I mean, this one always blows me away as a this is one of our early results, and actually was really interesting because this was a guy, really nice man. He was worried about the extra. I actually think his, on the left hand side, is his physique was absolutely fine, but you know, again, this is who are we to judge? It is, you know, something that bothered him. He found that in t-shirts you could see quite a lot of breast tissue, and he didn't like it, and he was pretty steady weight, just didn't like it. So there are considerations with male breast tissue, which I will not go into great depth here at this webinar, but we have to make sure there's no medical reason. We have to make sure that we're not treating something that we shouldn't treat. But actually, if the male breast tissue not only has glandular tissue there, like the female breast, but also has fat. And also it can be asymmetric, as can female breasts. And so therefore, once we evaluated him, he actually had a CoolSculpting procedure, amazing results, and also almost seemed to give a breast lift. I think this photograph almost shows this sort of shift up. But actually, he was really delighted with that, and got a superb result. And I think this demonstrates how you can treat the male chest area incredibly well. Can you just show the next slide, please? I don't know whether we've got another one on that. Oh, no, this is. But Ria, just before we talk about thighs, you treat quite a few male breast tissue, don't you?
Yes, so it's a very popular area amongst men, chest, waist and tummy area. A lot of men are self-conscious about their chest in tops and out of tops.
Really? That's interesting, isn't it? No, and it can be a bit of a pinchy area to treat. I know that, Ria.
Yes.
It is a bit pinchy, isn't it?
Around the nipple, definitely.
Yeah.
But it gives great results.
Yeah, again, generally we're forgiven once the results come through. Next slide.
Later.
That's fine. This was actually, I've done this, shown this slide deliberately because this was not, this is something that we were involved in quite a few years back, which was the clinical, in-the-house clinical study, a clinical evaluation as we call it, to see how well thighs reacted to CoolSculpting and to use certain applicators with it. And actually, the results within the thighs are very good. Now, what I want to say is this: when you first look at this slide, it's very easy to look at this and think, well, that's not very impressive. You know, I don't think that's that. I don't think that's very good, really. It's sort of very, very minimal. But if you actually look just where the pants meet the upper thigh, it's just one treatment. This is just one treatment on each thigh has generated quite a significant thigh gap. With thighs, we get very, very good results, but we may need to do a couple of treatment sessions. So we do one session, review 8 weeks later, which is what this shows. And then we will always warn a patient, now just beware, you may need a second treatment session to give you that optimal wow effect. Now this is because some areas of the body seem to be slightly quicker responders than others. And this is not a negative, this is facts. This is just the way the procedure and the way that the human body is. So we always warn. Now, interestingly, for a lot of patients, one treatment on the inner thigh seems to be enough. They feel better in their clothes, because I think, and I feel this personally myself, I think it's the way you feel in jeans, in tight trousers, in clothes. If you feel your thighs are quite full or rubbing, it can be quite an unpleasant sensation, and it's not something that patients like. But actually, when you generate that thigh gap, clothes look nicer, they drape off the thigh better, and actually feel better. So this is just showing the results of one treatment, but often we go on to do a second treatment. This clinical evaluation was just on the inner thigh. What we would often do for this kind of patient, should they wish, and should it be what they desire, you can also treat the outer thigh to give a circumferential reduction in size and streamlining the legs to make them look a little longer. If you do the next slide, and I'll let Ria talk, because Ria, you often do round the world treatment, meaning circumferentially the outer thigh, which wasn't treated on this lady, but the outer thigh and inner thigh, don't you?
Yes, so I really like leg treatments. We can treat the inner thigh, even underneath the buttocks, what we call very cutely the banana roll, as well as the outer thigh. And just going round these areas from a 360 approach can make a great impact. And really, your hip width is your hip width. It just neatens you and does lengthen the legs, just makes everything look neater, because naturally women are heavier in these areas.
Yeah, and it can also make the butt look a little bit perkier as well, because you're shaping around the buttocks. It can
Exactly.
actually generate that look, can't it? I've seen you do those, and I've seen in clinic that being done, and that's quite clever. And something, again, as I said, as we've evolved with CoolSculpting, we've become more creative, and it's a very, I cannot stress this enough, it's about the artistry. I always say, look, it's not about plonking an applicator plonk onto a bit of fat and reducing the fat. All you get there is a dent or a dip or something that you've got to be artistic, you've got to know what you're doing to get these beautifully smooth results. And that's what you are so good at doing. That's what, you and Madra are so good at doing, because you know how to make the technology work to its best. And that's what I believe is the real secret with body contouring CoolSculpting procedures. For me, that's the magic, that's the key to getting the best result. Next slide, please. Oh, I mean, this is a surgical result. I'm sorry, I'm very biased, and I declare that to everybody looking out there. I am biased. We are talking about something we love doing, so we will have a natural bias towards this treatment. But I would challenge anybody not to say that this is an amazing result. Surgical arm lifts are great, but they give scarring. It's fact. I'm a great believer in, non-surgery, where surgery is necessary surgery. I'm not damning surgery, but this is amazing. Talk us through this one.
So this is 2 applications each arm, and that's it, just one visit. Fantastic results. I don't think, like with all our before and afters, I don't think you could really look at this lady and say she's had anything done. She just looks like she's shrunk there and lifted.
Yeah, it is phenomenal. And what Ria means by the chocolate is, what this is again about the artistry. So when you come into clinic, you'll see, if you come and see us, we'll explain how we go about treatment. But by overlapping applicators like this on an arm, you manage to give a double hit on the fat where you overlap, so you reduce the fat more. And where the biggest bulge is, that's where the overlap of the applicator will go, and it generates this really nice smooth result. And the skin tightening, the skin retraction there is superb. It's a great example of why it's so good to have CoolSculpting here, because it causes the skin to lift as well. It doesn't leave baggy skin. Can we show the other side? It shows the other, I think, yeah, the other arm. Beautiful. You can see the muscle definition coming through there, but not because the patient has been exercising, but because of that exposure of the muscle from reducing the fat pocket. Frankly, I think that's extraordinary. Go on. Next slide, please. Oh, that's just, again, the testimonials. We're just going to go on to now chins, and then we'll open up for Q&A, just so you know. Again, we were involved in the clinical evaluation of the submental area, the chin, the double chin. And again, Ria, talk us through.
So this lady had very little confidence when she first came to us. She could barely look at you in the eye. She was very unhappy with herself, despite being a very attractive and nice person. It's taken years off of her. We did 3 applications with the Cool Mini to either side to narrow around the jaw area and on the central part. And she is just a different person. She is so much happier and more confident. It's really lovely to see.
That's what it's all about. I mean, I think this is incredible. Can you show the side view, please? Next slide. Thank you. I mean, that is great. Again, demonstrating what we said: skin lift, soft, beautifully contoured jawline. It makes the patient look like they've lost weight, which they haven't. I think it makes them just look very fresh. Enhances the look really nicely. In these cases, I won't go on to what we do with facial work, but sometimes with patients like this, depending on what their desires are, sometimes we can even, with injectables, just project the chin a little bit further so the lines look even cleaner. we can, but often as a standalone treatment, which this, you know, CoolSculpting is enough. I mean, beautiful result. And again, I think brilliant artistry there. Okay, next slide, please. Yeah, and it's about how people feel. It's about what this treatment does and how it makes them feel, which I think is, you know, amazing. Next slide, we're going to show a male chin, and then we're going to move on to Q&A. Again, this is a treatment I'm familiar with from having a chin treatment. Weight stayed the same. 8 weeks later, this was a couple of applicators overlapped where the heaviest part of the fat was, to give the biggest hit on the fat. You can still see a little pocket there, but it's dramatically better. If we were going to be really pernickety, we have the option 8 weeks later to go back and treat a little bit more if we want to, or if the patient wants to. It's not what we want, it's what the patient wants. But really good result. And I think in a minute, there's a slide, next one, that shows this patient, oh no, that's side view, I beg your pardon. So the side view again shows really, really nice contour, really nice reduction, extending up the jawline. But if we go on to the next slide, yeah. So what this shows is after 2 years, patient coming back, again, it's maintained, the result has been maintained. Really, really good definition. And again, I think this is one of the most popular areas for men, because again, they can have it done. There's no downtime apart from a tiny little bit of maybe a little bit of pinkness for the rest of the day, maybe a little bit of tenderness for a few days later. They can go back to work as normal, but super lovely result, isn't it?
Very nice.
Okay, so can you go on to the next slide, please? Before we just go on to the Q&A, and before I reference this, can we just give me, I did this on Wednesday, your top, if I don't mind putting you on the spot, Ria, 3 reasons why you love CoolSculpting.
How it makes my patient feel, the fact that it's permanent, and that it's very safe, and it just works.
Yeah, very simple. That's it, that says it all. I think that's the thing. I think that you trust the technology, you trust that it delivers, because it's FDA cleared, it delivers safe results. And, you know, the proof of the pudding is exactly what we said. It's in the patient's feedback, and that's what everybody wants to see, is what do the patients think about this treatment. So before we open to Q&A, I just want to thank you very much for attending the webinar. We know everybody's very busy, even in lockdown. People lead very busy lives. For every attendee today on this webinar, we are donating £10 to charity. And so thank you for your contribution to that. I think at the moment we're very mindful of anything that we can do to give back in what has been a very difficult year for many, many people. So thank you for that. But we're going to open up and to Q&A now. We've got a lot of Q's and A's. And actually, I do need to go back to that slide. Sorry, that last one. It's just saying if anybody wants to actually book a complimentary consultation, or actually just find out a bit more after this webinar, our phones are open until 5 p.m. this evening, obviously open again on Monday. That's the number to ring. And anybody that does want to engage with it, you know, obviously you need to find out more, but anybody who does want to, a consultation, and maybe at the end have any kind of treatment, there is a special 30% reduction in fee for anybody from this webinar. So you just, you'll be sent out a code on your phones by text, just so you can redeem that discount should you ever go ahead with any treatment. So I've been sent a lot of Q&A, a lot of questions, and in our last quarter now, we want to try and crunch through as many as we can. Somebody asked, what happens after treatment? Do I have follow-ups? Ria?
Yes, so I would book my patient usually anytime between 6 to 8 weeks, review how things are going so far. A lot of areas do actually show sometimes even mostly the full result at that stage, but it will tweak, alter as time goes on. So I would always book a further review around 12 weeks.
Lovely, thank you. I am going to whip through these because there are so many. There always are. As somebody has said here, of course, CoolSculpting is not a weight loss solution. but does it work on slightly bigger people? I think we sort of touched on that, but yes, it does. We have to be ethical, responsible in what we're saying to people. But yes, we're not. It can work actually very well on bigger people. We don't want people to be undergoing CoolSculpting if it's not appropriate, but actually it can, and we take everybody individually. If there's a certain area that people just want to kickstart help with, and it gives them that push to get going on to some, a slightly healthier lifestyle, or just, gives them, that would be great, and we do that, yeah, but we do it with clear understanding and clear consultation process, so you know what you're likely to get from that treatment and what the limitations of that are. But yes is the answer. We can. Somebody's asked, what do you mean by 3 applicators? I know what you mean. It all sounds like gobbledygook. All we mean there is to get these very smooth results. We have different shaped applicators that go on that hug certain body parts. They're different shapes, sizes. When you come into clinic, you'll see what we mean. And it's the way we position them on you and overlap them, because you're a certain size, shape. So we actually use different ones on the body overlapped to get the best smooth result. It's quite hard to explain without showing you in clinic for you. But what it means is that we can do all these three applicators in one go, but we're overlapping them to give the hit on the biggest area of fat where the biggest bulge is. So when we overlap them, we get more fat reduction, and then we blend out the other side. So I hope that sort of explains it. Would you say that's fair, Ria, what I've said?
Yes. It's treatment applications and how many we may need dependent on the patient's personal area.
Yeah, absolutely. Somebody said, can you drive yourself home after treatment, Magda?
Yes. Yes, you can. You will feel absolutely fine to drive home. Any slight discomfort is really whilst you're initially with me, and then you'll have a little bit that remains, but nothing that will stop you doing your usual activities.
Yeah, good. Someone's asked, can you exercise immediately after treatment?
You can. You may not feel like you want to exercise immediately afterwards, but I would encourage you to stay very active. Anything that's good for lymphatic drainage will help shift those fat cells out that little bit quicker, which will reduce any swelling quicker, which will actually make you feel even more comfortable more quickly. So I would exercise, but if you've had your abdomen treated, you may not want to do stomach crunches, for example. You may be happier with a walk or doing the plank. Even using the muscles will be absolutely fine, but it's just any pressure, you'll have a bit of fluid there.
Yeah, there's some brilliant questions coming through. I mean, I'm so, but it's just such good questions and quite challenging questions too, which is great. Somebody's asked, in relation to the statement that each person has a certain number of fat cells and the CoolSculpting treatment removes some of these fat cells, does this mean that if you go on to eat more, for example, that you can never put the fat back on? That is such a brilliant question. If you don't mind me tackling that one, and then you can, that is a brilliant question. In answer to the question, once those fat cells are gone, they are gone for good, yes. So when you are, I wish we could show you this, but in clinic we have this photograph. We have a photograph of a man. We have who's had his flanks treated. He then is photographed when the result is there. Great result, nice smooth flanks. And then there's a photograph of him a few years later when he's put on, I think it's about 10 pounds or 12. I think it's quite, it's not a lot, but it's about a stone. Let's say a stone anyway. I'll speak old fashioned, it's a stone. And actually there is no increase in that flank area. It stays flat. So this is the point here. If your weight is pretty stable, and we're not here to say you've got to stay, 1 pound with it. No, I don't mean that. But if your weight is pretty stable, most people go up maybe 2-3 kg throughout the year, back, up, down a little bit, depending on how much fun we're having and how many holidays we have, which is 0 at the moment. Then actually the results stay the same, no problem. If you gain a lot of weight after CoolSculpting. If you go up by, I don't know, a couple of stone, you won't necessarily gain weight in the area that's been treated, but you may put on weight elsewhere. That would make, well, you will, that makes sense. But the actual act of CoolSculpting does not make people gain weight somewhere else, because the next question people ask, well, hold on, if you take fat away from there, surely you put weight on somewhere else, you know, it's distributed somewhere else. And the answer to that is no. If your weight's fairly steady, the result remains the same, the rest of the body remains the same, no problem. But if you gain a lot of weight, of course, the fat cells that are existing still there are going to swell. They're going to swell somewhere. So the treated area will remain good, other areas will get bigger. But CoolSculpting does not cause fat to go on in any other area. I hope that is clear. I sort of extended the answer to that question. There's so many, I just don't even know how to answer them. Oh, this is good. How soon do you wait in between treating the same area with 2 treatments?
So if it's an area that I've already just sort of from my assessment thought we will benefit from doing another one each side. So often say inner thighs, I do one each side, and then I might book them 6 weeks later to do another one each side, because it's a slightly longer pocket. You get heaviness around the back and a little further forward. And I just find you get the neatest results doing it in that process. So sometimes I will, when expected, just book them anytime around 6 weeks for that treatment. We will always review at 6 weeks. Often that is the point where people may say, right, this is great, but I want more, or I want a slightly different area is more likely. So if we treat the lower, you might want to treat, say, the very upper, then bothers you because that is so refined below. So 6 weeks is usually a good time to assess. But if somebody is time limited and we already know in a plan that we might want to do more, then we sometimes can earlier, but generally I might wait even longer than that, sometimes even longer than 6 weeks.
Yeah, it's really good. And the other thing is, people often say, is there a limit to how many applicators you can have? It's sort of on to what you said, a limit to how many applicators or how many areas you can treat in one go. We often dual sculpt. I mean, this is the other thing that we didn't touch on today, but because we have so many machines, and we can actually treat 2 areas in one go, 3 areas, or even 4 areas in one go. But you know, the more you have done in one session, the little bit more challenging it becomes. But even then, it's very tolerable. You know, it goes to say, you know, that the more areas you have done in one go, you know, you feel it in more areas. You know, we have some people have chin, arm, abs. Yeah, that's a bit more challenging, but it can be done. And some people come from long distances, they're busy. It can be safely done, is my point here. And I think that's what makes it interesting. But yes, repeat treatments. Again, it's quite bespoke. You do have a formula, but you actually sort of tailor make it to people, which I think is the most important thing here. Does massage after treatment help accelerate the removal of frozen fat cells, Ria?
Lymphatic drainage in general will help remove them. So sometimes feeling tender with the swelling, you might not feel up to massaging that area. It's only one of many things. Drinking plenty of water and exercise does a very good job. They would work their way out anyway. But if you didn't feel too sore and you wanted to lightly massage the area, you absolutely could.
Great answer, thank you. Does this treatment work on areas that have had liposuction? Who wants to take that question on?
Well, I've had lots of patients have liposuction and years later neaten up little bits with CoolSculpting because they were happy with their procedure, but they don't want to go through a surgery again for the bits that they would like to alter, now that CoolSculpting is such a great non-surgical option.
Yeah, that's true. And we also, you know, we often see people post like cesarean section as well. This is another angle where people have had C-sections and they got that little bit of fat overhang some years later. We can treat above a C-section scar. There's considerations when people have got a scar on I'm talking about abdomen now, but nonetheless you can treat to blend that fat into the C-section scar, so you don't have the overhang, the over hang. And somebody asked actually the other day about just the mons pubis, just above the pubic area, whether you can get deposition of fat there. And my understanding is you do those treatments, don't you?
Yes, fairly frequently.
Yeah, I didn't answer it on that day, but it was something. Another, great. So many good questions. We're inundated. Would men have to clean shave for CoolSculpting on the chin area, or would it work if you still have facial hair?
It's better that the area is clean shaven, only because it can make the applicator slip slightly.
Yeah, that's a good
reason. But if they didn't, because they couldn't part with the beard, it will still treat the same fat cells. It's just you might get pop-offs during treatment. The applicator may be disturbed by the hair.
Yeah, we don't really want any of that. So we want the best treatment we can deliver. So clean shaven, and obviously after treatment, it's absolutely fine, whatever you do. What's the oldest age this could work? I'm going to pitch that because I remember that from the early days. I think Ria would say, we don't actually have an age cutoff. And I know that sounds, of course, if we've shown, or we've tried to show a representation, we can't show all of our befores and afters because we've been working with this technology for many, many years. When you're in clinic, we can try and show you photographs of people that have consented to show their photographs. Obviously, we can't show every patient because we have to let them agree that we can show their patients, but we have so many now over the many years. We treat any age, and I think, but with really honest dialogue. One of the earliest patients we treated in the early days, I believe, was in her 70s. She was getting married. And she wanted to look very nice in her swim costume. She wasn't wearing a bikini, but she was going away, and she had a bit of a tummy, and she just wanted to feel more confident. Now, we counselled her and said, look, even though the skin does retract back, your skin quality may not be up to this quite so well. How would you feel if it didn't snap back as well? She was absolutely fine with that. She just wanted to look good in my clothes. So it's all about appropriate consultation and setting realistic expectations. And if the communication is clear, I don't think there is an age cutoff. I'm a great one. I say this with lots of things. It's about making people feel good, whatever way that's delivered. As long as we're not doing anything that's not appropriate, and as long as we're not doing anything dangerous, which it won't be, then a clear discussion about expectations is all that we need to do. Somebody's actually said, and I'm going to address this, we've heard almost everything apart from prices, and that's deliberate. That's not because we're being cagey. That's because this is actually a bespoke treatment, and we can give you an idea offline if you want to ring up and just say, look, it is hard to do that because by the very nature of what we're going to say, it can be misleading. If somebody's a different tummy, it's very difficult. We've got to work out how we do it. And that's why it's really important to see you in person. So if you actually give a call, that person, just give a call. They may well, on that phone call, be able to give you an idea. But what we don't want to do is mislead you. And that's important. So if you ring up, just say, look, the call takers are very experienced call takers for CoolSculpting. They'll obviously try and get you to have a consultation, because that's the only way you can get the realistic pricing and be clear on that. The last thing I say we want to do is say something that ends up being completely different to what it will be. And that's why the girls do, that's why we do complimentary consultations, actually, because you don't commit. You've not invested any money having a consultation. All you've done is a fact-finding mission. And then it's up to you. Go away, have a think about it, ask further questions. And that is why we do that consultation. Somebody says, if you have a chin treated, does it leave baggy skin like a turkey? Yeah, that's one that is often asked. The answer is no. We do see skin retraction. Everyone's different. Your skin is different, unique to you. But I hope we've shown, actually, generally speaking, that skin retracts back. But we have to take all kinds of things into account. And that's what the girls do all the time. We take your skin quality, the kind of thickness of your skin, your age, your life, so all kinds of things. But the honest general answer to that question is no. The general answer to that question is it should give nice skin retraction. We had a really good image, which we didn't include with the video, which we could show you or send. It's of a lady called Jenny Murray, who was a Woman's Hour. Stop doing that now. She was a bit of a skeptic, actually. She came in and had treatment with CoolSculpting a few years back, and she had really nice skin lift and retraction. And as a consequence of being convinced, she then wrote a double-page piece in one of the national press because she was so blown away by it. But she started off a real, what I would call a real skeptic. She really wasn't sure whether it would do it, and it did it beautifully for her. There are so many questions. I want to keep this to time, so maybe we'll just run over by another few. What I wanted to say, and I said this on Wednesdays, there are so many, and we do want to answer them honestly. So you can either ring up and ask, or you can email us in. If you email us in what these questions are, we'll do our very, very best to answer each and every one of you, because you're really asking really quite challenging, interesting questions. And I'll do a difficult one. What happens to the appearance of cellulite? I'm considering treating both the saddle bags and banana roll, but I've got some cellulite. I'm wondering how that will appear post-treatment. Brilliant question. Ria, do you want to take that on?
Yes, so very common question amongst us women in particular. It does help cellulite. So it's not a treatment for cellulite. Fat reduction is its very best job. So the area has to be suitable for fat reduction because it works too well that if it's not. So on the outer thighs, often there is a little bit more of a roundness than what we would always like, and the skin texture is quite uneven, and it does, the retraction and the fat reduction together really helps reduce the appearance of cellulite, definitely for the banana roll too.
Yeah, I mean, it's a good answer. And I mean, it is not a treatment for cellulite. We have to declare that, as Ria said, categorically. But there is no doubt that freezing seems to, and certainly on thighs with these round the world treatments that you do, Ria, where you're wrapping, you can get some real improvement in the skin quality and tissue. The other thing I mentioned the other day was abs, and I can speak for, from personal experience, where if your abs were a little bit wavy, not necessarily cellulite, but, a bit wavy where the fat, under the breast, and then sort of goes in, and then it's sort of slightly uneven. What we would do there often, depending on what the assessment is, we either use the traditional applicators to pinch off the grabbable fat, but you can actually use what's called the Cool Smooth applicator, which just is a sort of flat it lays on the tummy, and it just takes down those hillocks. So it actually gives a beautiful smoothing and a skin tightening effect, which is superb. It's a really clever applicator. I would be honest and say probably underused in the past, because we didn't realize how versatile it was, but it can give the most amazing smoothing off effect. That was a really, really super question. And as I said, the quality of these questions, it's almost quite frustrating because, there's so many that are so good. So let me just finish off with one that maybe, can you manage tiny underbutt areas? Can the applicators work there? I think what that means again is that, the double bottom.
Yes, banana roll, double bottom, very effective. We just place the applicator sort of underneath the bum to that roll specifically. We have a few different applicator sizes that suit this area, so it's just a case of measuring you up to see which one would fit your bump the best to give the best contact for cooling. But it's a very successful area, and it just brings that sort of upper thigh area in from the back, allowing more sort of distance between the bum and the leg, or more refinement, I should say.
Yeah. Someone just asked me, do we do remote consultations? The answer is yes, we do. We can see you in a number of ways. Just ring up and find out for us. We do love to see you in clinic preferentially, because it is a touchy-feely assessment. Of course, we can give you an idea on a virtual, of course, and we've all learned to live by virtual as we're doing now. But there is no doubt when you get in clinic, because we can swizzle you round, and we look at you at every angle and tip our head and have a look, because on photography, even if people give a front view or on virtuals, even if that they're swizzling around, it's not quite as crisp an assessment. by being able to grab and see what we can do, it ends up being a much more exact assessment. But of course, we've all learned to be creative in these quite challenging times, but the team would always like to see you in-house, just because they feel it's more accurate for you, and then you can go away, have a think about it properly, rather than having to change a plan when you get into clinic, which is a bit frustrating. Any top question? We'll have to wrap up shortly so we don't go on. There's still so many people online, but we will answer your questions by email. Anything you're asked a lot, Ria, that you feel is a question that's always asked of you, that people always ask or get confused on or need more clarity on?
I mean, the main thing is patients saying, you know, does it really work? What would that look like on me? Because it does just sound too good to be true. So often I'd encourage a patient, they often have a bit of a shopping list. There's always a priority, you know, but who wants bra fat? That's always an area we move on to at some point. So it's just a case of starting with that one area that bothers you personally the most. You see those results for yourself and then come back for your review, and then we can talk about other areas rather than doing everything in one go.
Yeah, that's really, that's a great thing to end on, because yes, of course we can do every area, and there are plenty of people that do. They come in and have a shopping list, and as I said, it's very safe to do so. We can do quite a lot in one treatment session, which is absolutely fine. What we like to do, of course, is do an area really, really well to prove it, to prove this works, to show you and demonstrate what happens. So, for example, you know, it's people's jobs like, right, Ria, if you've got tummy fat, and if it's better to treat your flanks as well, because you'll look so much better, you'll get more of a wow with doing the flanks as well as the tummy fat, they will tell you that. Because at the end of the day, you want to get a wow, or most people want to get a wow. So, but having had a wow somewhere, you're convinced, yeah, that's fine, that works. And then you feel more confident or to carry on with doing other areas, should you so wish. I mean, you may not want to, and you may not need to. But I think that's what it's about. It's about getting good assessment. Because if anybody can stick an applicator on a bit of fat, that's not what this is about. It's about getting best result so that you go away because it's permanent. It's an investment, long term. So we've got to get it right for you from that get-go. And I think that's the messaging for today. I'm afraid we're going to probably have to wrap up, but we could go on. I thank you all, the engagement you've all given. You know, we put these on because we hope we're going to provide a service to people, but the engagement is frustrating because I've seen so many questions I can't answer, and there's nothing I won't answer because actually they're all very valid questions. But if we could get those emails in, just a one-liner, we'll try and get the answers, or even on phone call, we can answer things. So thank you so much for attending today. It's been a very successful interactive session. I'm so pleased we had Ria here, who's an expert and knows all the answers to absolutely everything. And I am very grateful for your attendance. And once again, thank you so much, because your attendance is donated to charity. And I think that makes us all feel better about doing these things. So thank you very much. I think there's going to be a holding slide just with that number again, should you have missed it earlier. But thank you for attending. And I think we've all had a really fruitful discussion this Friday afternoon. So thank you very much, everybody. We'll just hold that on there for another few seconds so that you can jot that number down should you need to. As I say, our lines are open till 5 o'clock, and we're open again on Monday morning. The teams are very, very good at answering your questions, and what they can't answer, they'll ask us to answer. So thank you very much indeed. Have a great afternoon, everybody. And once again, thank you for attending. Bye-bye.
Thank you for your time, everyone.
Thank you, everyone. Bye-bye.